Mindfulness instructions number 7, meeting chronic pain. Let's begin. Gently close your eyes. Allow your attention to come into this space, letting go for a little while your to-do lists, any expectations, and the need to change or alter what is happening in this moment. Now bring your attention to your body. Notice your feet on the floor. Notice where your hands are. Maybe resting on the thighs, folded together on your lap, or at your sides. Feeling the chair beneath you, sensing how the chair supports you, how the floor supports the chair, and how the earth supports the floor. Feel supported in this moment. Now allow your attention to find your anchor. It may be your breath. Notice where in the body you feel it. Perhaps the tip of the nose, the nostrils, the back of the throat, the chest, the belly. Just notice that sensation. Connect to the sensation of breath and the spot within your body where you feel it most. Or perhaps your anchor is the sensation of your hand where it touches your body, where you feel the texture of the fabric under your fingers, or the smoothness of your skin under your hand. Allow this to become the anchor of your attention, recognizing the sensations of your fingers as they move against your skin or clothing, the sensation of increasing pressure. Know that these sensations are always with you, have always been with you, and can support you as you travel through your days. Know that at any time when your mind has wandered into thoughts, feelings, or body sensations, the breath or the touch of your hand will bring you back into this precious present moment. Physical pain is an experience that everyone has had. No one can escape this human experience. Sometimes the pain is acute and therefore only short-lived. Sometimes pain can continue over a long period of time. And sometimes pain can be unrelenting. Pain that, even though its intensity can vary, nevertheless is chronic. Any type of pain can be a challenging experience, not only from a physical perspective, but also because it can negatively affect your thoughts and emotions. Pain is a very powerful experience that can affect all aspects of your life. Strategies to deal with pain include direct intervention, such as medication, body movement, or massage, or moving away from pain, such as through utilizing distractions, imaginal interventions such as guided meditations, or simply to try and ignore the pain. While the third strategy is moving toward the pain, and this is where mindfulness comes in. Contrary to the other strategies, and in a counterintuitive way, mindfulness suggests that an effective method to deal with pain is to be fully present with the experience, to focus our awareness on the bare and raw sensations of the pain, and to become a curious explorer of the pain itself. To be clear, mindfulness lays no claim to be able to completely alleviate chronic pain. Rather, the research and experience reported by mindfulness practitioners is that relief comes in how you relate to the pain. That is, through changing your relationship to the pain, you can positively change how you experience it. While the following mindfulness instructions are presented as ways to interact with painful sensations, a fulsome and complete mindfulness strategy also includes the application of attitudinal foundations of acceptance, non-judging, non-striving, patience, beginner's mind, trust, and letting go or letting it be. These attitudinal foundations are critical in assisting you to find a healthier way of being with pain, of meeting pain. First level of response. If you find that your attention has been hijacked by a painful sensation or a thought or feeling associated with pain, and you have lost the breath or the touch of your hand as the anchor of attention, then notice it. Label it as just that, a thought, a feeling, or a physical sensation. Then gently and without judgment, bring your awareness back to your anchor of attention. Second level of response. If you find it difficult to return to your anchor because the physical sensation of pain or thought or feeling associated with pain has become too strong or too intrusive and has captivated your awareness, then allow your attention to temporarily find where in the body that intrusion resides. If your attention has been pulled from your anchor because of a painful physical sensation, locate the area of your body where you experience the pain. The pain can, of course, be anywhere in this bag of bones that comprises your physical body. So be specific in identifying exactly where the pain resides. Without attaching a story to the physical sensation, just become curious as to where you feel it in the body. As you locate the body area that holds the pain, become very curious as to what the physical sensations are like. Is there tightness, clenching, pressure, burning, throbbing, stabbing? Is this sensation localized, or does it radiate in a direction? Outward? Inward? Is there a warmth or a coolness? Is it big? Small? Can you sense a shape or a density of the pain? Continue to hold your attention and explore in minute detail the sensations associated with the pain in your body. As you explore the pain, perhaps you notice that it has moved, sometimes in a dramatic manner to another part of the body, or sometimes just a slight shift in location. Continue to track and explore the pain sensations. Like a dog who won't let go of a bone, hold on and don't let your attention be pulled away from your exploration. Over time, as your attention has been exploring the body part, perhaps you notice that the sensation is somewhat dissipating, lessening in intensity. If so, then once again allow your breath or the pressure of your hand upon your body to become the anchor of your attention. The gentle in and out, rising and falling of the breath, or the movement or intensity of the pressure from your fingers or hand where they are contacting with your body. However, you may find that even with a concerted exploration of the physical sensation, it continues to be intrusive. Maybe you feel you need to move your position, or scratch the itch, or rub the numbness. But before you act, become very mindful as to how you will move. The idea is to respond and not to react to the physical sensation. So with an itch, maybe decide if you will use the right or left hand to scratch it. What finger will you use? Or will you use more than one finger? How will you then place your hand back on your body once the itch is scratched? Maybe your shoulders are tight from sitting, and you feel you need to stretch them. Again, become mindful as to how you will do this. Will you roll one shoulder at a time, or both? Will you roll them backwards or forwards, or both directions? Once you've decided how you will do it, then do it, and observe how your attention, drawn to that physical sensation, may have lessened or dissipated. And sense if you can now return to the breath or hand sensation as the anchor of your attention. Perhaps there is a thought associated with the pain, perhaps a sense of being preoccupied with it, or ruminating about the consequences of the pain, or a judgment about yourself as being weak or helpless. And if the thought is strong enough to continually pull your attention away from your anchor, it will also be associated with a feeling, an emotion. If it does not have a feeling attached to it, then it is not likely strong enough to continually hijack your attention. For example, let's say that a thought about the ongoing effects of the pain is causing anxiety. Very gently begin to find where the anxiety is located in the body. Do a brief scan of your body to find where that feeling is held. While it might be held in the painful area, it may also be held in another part of the body. Be curious and explore where the emotion associated with the thought is held. Is it in the jaw, the chest, the belly, the hands? Without attaching a story to the emotions, just become curious as to where you feel it in the body. Become very curious as to what the physical sensations associated with the feeling, which is attached to the thought, are like. Is there tightness, clenching, pressure? Does this sensation stay in one spot, or does it radiate in a direction, such as outward, upward, inward? Is there a warmth or a coolness? Is it big? Small? Can you sense a shape or a density of the sensation? Continue to hold your attention on the sensations associated with that place in your body. Over time, as your attention and exploration has been placed on the body part, perhaps you notice that the sensation is somewhat dissipating, lessening in intensity. If so, then once again, allow your breath or the pressure of your hand upon your body to become the anchor of your attention. The gentle in and out, rising and falling of the breath, or the movement or intensity of the pressure from your fingers or hand where they are contacting with your body. As you continue to be mindfully aware of your anchor, perhaps again your attention has been pulled away, possibly this time by a strong emotion that is associated with the pain. Perhaps the emotion is fear, or anxiety, or irritability, or sadness, or resentment, or depression. As you have learned previously, upon identifying the feeling, label it as such, and gently, without judgment, return to the anchor of your attention. However, if you find it difficult to return to your anchor, then it may be necessary again to temporarily change the anchor of your attention from your breath or hand, this time to wherever the strong emotion that has arisen is located in your body. The area of the body may again be where the pain is, but it may also be held in another part of the body. Be curious and explore where the emotion is held in your body, and direct your awareness to that place. Move your attention from focusing on the breath or the pressure of your hand as the anchor to now use the identified body part as your new, albeit temporary, anchor of awareness. When you have discovered where in the body you feel this emotion, then start becoming curious as to what you are experiencing. Deeply examine the body sensations associated with the feeling. And be mindful that with strong emotions, stories will arise also. Stories about who or what has caused this to be. If this happens, when this happens, simply drop the story. Leave it for another time and return your attention to the sensations you're having in your body that are connected to the emotion. Notice what you feel with this emotion in your body. Tightness, tingling, a racing heart, numbness, pressure, hot or cold. Are these sensations small or large? Do they move? Are they moving to another part of the body? Be curious. There is no right or wrong way to feel emotions. Even though you may have had this emotional experience before, with a beginner's mind, be very open and curious as to what it is like in this moment, not judging or labeling, good or bad, just being a curious explorer. As your attention has been placed on the sensation of the body part that was associated with the emotion, perhaps you have noticed that the sensation is dissipating, lessening its intensity. If so, then once again allow the anchor of your attention to come back to the breath or the pressure of your hand, the gentle in and out, rising and falling, or the texture of the fabric beneath your fingers, the pressure of your hand upon your thigh. Being mindful is not just about being with easy thoughts, emotions, and physical sensations. It is also about being able to stay present with raw and often painful thoughts, emotions, and physical sensations. There is no reason to hide or try to change these challenging moments. Mindfulness practice gives us the opportunity to open ourselves up to these experiences, to explore them with curiosity and without judgment, to not close ourselves off from these painful aspects of life. And over time, with practice, we can become more trusting in our capacity to be with whatever arises, the good, the bad, or the ugly, as Clint Eastwood would have said. Mindfulness as a practice offers us a different way to work with the intensity of what we are experiencing in the moment. Working with pain is similar to working with other very powerful emotional and physical experiences, such as grief. While we use the above responses as our first and second responses to be with these experiences, we can also use additional ones when the emotional or physical experience is very strong. Third level of response. So if you are noticing a rising of thoughts, emotions, or physical sensations in connection to pain, let's step for a moment into this space with the utmost love and compassion towards ourselves. Pain is a powerful experience that deserves our conscious respect, but not fear. It is just another cognitive, emotional, and physical experience that we can befriend. Just notice whatever it is that arises. A thought about your pain, an emotional reaction to having pain, or a physical sensation that is the pain experience itself. When the first and second levels of response do not provide some relief, then you can move to the third level of response, just as you did with powerful grief experiences. You can now couple your usual anchor of attention with the place in your body where the pain sensation arises. Identify the area of your body where you are experiencing pain. If you are using your breath as your anchor, now intentionally direct your breath right into that pain region with the in-breath. Feel it coming through that painful area. And on the out-breath, feel it leaving from that painful area. Breathe in and breathe out. Breathe in, breathe out. Moment by moment, allowing the breath to bathe that region with the incoming breath and then to wash it away with the out-breath, allowing your awareness to hold both the pain and the breath simultaneously. If you are using your hand sensation as your anchor, allow yourself to move your hand to the place in your body where you are feeling the pain. Perhaps it's in your stomach, or shoulder, or jaw. Wherever in your body it may be, place your hand, fingers over that area. Allow yourself to continue to feel the sensations of your hand over this area of your body. Feel the pressure or slight movement of your hand over your painful body area. Feel the texture of the fabric under your hand as it touches the pain. You are not trying to take the pain away, just directing your attention through your anchor, breath or hand sensations, to the painful area, using your anchor to focus on the painful area, experiencing the sensation of breath washing in and washing out like waves of the ocean, or the changing sensations of your hand on your body, where it is experiencing the pain, ever so gently touching the pain with your anchor, being curious, watching what happens, seeing how it unfolds moment by moment. If you find that the painful sensation lessens or dissipates, move your anchor away from the body area and return to your usual way of focusing your attention on your anchor of awareness, using the breath or your hand sensations to hold your focus. Fourth level of response. If you found the third level of response to be difficult to do because the pain experience is so strong that it continuously pulls your attention away from your anchor, or perhaps you feel like you can do nothing, you feel frozen, then it is necessary to very gently and briefly approach your pain experience through a fourth level of response. Very gently notice if you can allow your attention to rest ever so briefly on your chosen anchor of awareness, to set your intention to hold your attention on only a small interlude of your anchor, even in the face of pain that you are experiencing. If you are using your breath as your anchor, set your intention to focus on perhaps just one in-breath. Nothing else needs to be done. Just one in-breath. Even in the midst of significant pain, you are setting a goal to hold your attention on just one in-breath. If you are using your hand sensation as your anchor, set your intention to rest for just a moment on the sensation of one finger pressing firmly into your thigh, or feeling for one moment the texture of the fabric under your finger as you gently rub it. See if you can, just for one brief moment, allow your attention to return to the anchor, even with the intensity of your pain experience. Knowing that the pain is strong enough to pull your attention away, make it your intention to return to your anchor, even for just one brief moment. Then, if the attention is drawn back to the intensity of pain thoughts, feelings, or physical sensations, that is okay, knowing that you were able to focus your attention on your anchor, on one half a breath, or on one brief moment of tactile sensation in your hand or fingers. Even with the raw pain you were experiencing, you were able to do this. Over time, try expanding your attention onto your anchor for longer moments. Still only moments, but nevertheless increased moments. Knowing that your attention is not able to rest in your anchor for long as it gets pulled into your pain experience. Very gently, make it your intention to allow your awareness to rest on just one in-breath and one out-breath, or on the sensation of your fingers pressing twice firmly into your thigh, or feeling the fabric texture under your fingers on 2 occasions. Know that the powerful sensations of pain will likely pull your attention away from your anchor. But ever so gently and slowly, extending the moments that you are able to keep your attention on your anchor of awareness, perhaps 1.5 breaths, or 2 breaths, or the sensation of your fingers on your body, clothing, for 3 sensations or 4 sensations. Just setting your intention to focus your awareness on your anchor for just a bit longer. There is no rush in this practice. It is a time to be compassionate and gentle toward what you are experiencing. You may be noticing the judging mind. It may be beating you up for the limited breaths that you were able to focus on, or on your ability to notice the pressure from your hand on your thigh. Again, with the mindfulness practice, simply acknowledge and label this as judging, and allow yourself to continue back to the practice. As you set your intention for 1 or 2 breaths, hand sensations, notice how that felt. Perhaps a sense of courage, a sense of accomplishment, a sense of hope that you can stay present to your experience without getting lost in it. Knowing how powerful your pain experience is, and yet you are able to stay with your anchor for moments. That even with significant pain, you are able to direct your attention where you want it to be, on your anchor of awareness. That being your breath or your hand sensations, for just a moment, and over time to see if you can extend your capacity to be with this pain experience for another moment, and later for another moment, not ruled by pain, but traveling alongside of it, meeting it, changing your relationship to it as you focus your awareness on your anchor of attention. Perhaps you have found this very difficult to do. Acknowledge that this is not easy. It takes practice, and practice, and practice, coupled with your intention to hold the attitudinal foundations in this experience: acceptance, non-judging, non-striving, beginner's mind, patience, trust, let it be. Be gentle and compassionate with yourself. Allow your courage to declare, I will try again later. I will try again later. As you continue to sit, remember that your intention with this mindfulness practice is to simply be in this moment. And in this moment, to be able to experience your capacity of being able to intentionally focus on your anchor of awareness, the breath or hand sensations, no matter what arises in the mind or body. To be able to befriend whatever arises, to travel alongside with whatever arises, even the more challenging and difficult thoughts, feelings, and physical sensations that arise with pain, to develop a sense of confidence and trust in yourself that you can meet whatever arises, not that this will be easy or painless, but to know that you do not have to hide or avoid or numb yourself to the 10,000 sorrows or challenges that are a part of this life that is yours. That you can learn to respond rather than just react to whatever arises, to be fully present. Now take these next few moments to keep practicing and be gentle with yourself. I will soon bring your attention back to the room. I will ring the bell 3 times. Slowly and at your own pace, allow yourself to open your eyes and bring your awareness back to the space while still being conscious of your anchor, of being able to hold awareness of your anchor even as you are conscious of your surroundings. Offer yourself compassion and loving kindness for the courage to practice and to explore new ways of being present to yourself, even in the midst of difficult experiences such as pain.